I kindly ask our guest, are you ready? On the count of 3 to unveil Pin, which will officially welcome the ORBIS Flying Eye Hospital to Toronto. 1, 2, 3.
So today we recognize ORBIS sharing medical attention for those that have problems with sight. What a wonderful day. We thank God for all the wonderful volunteers that have made this program possible.
The mission of ORBIS is to address the issues of avoidable blindness in the developing world. There are 39 million blind people in the world today. 80% of those 39 million people, their blindness could have been prevented and can be treated. So there's a huge disparity in those numbers, and ORBIS exists to address those issues and those statistics.
This is ORBIS International's Flying Eye Hospital. It's the world's only airborne flying eye hospital. And our nurse training program takes place on board this aircraft and also within our host hospitals around the world.
Well, welcome to the operating room on board the Flying Eye Hospital, the only DC-10 in the world that has an operating room inside, and we can perform the surgeries and surgical procedures in the developing countries to treat avoidable blindness cases. This operating room has been designed in a unique way to deliver the demonstration of surgical procedures to the local doctors in different developing countries. In this area we have at least 5 cameras to record and transmit live the surgical procedure that's being done here. The surgeon who performs the surgery is being mic'd so that he can talk and communicate with the audience who are sitting in the classroom at the beginning of the plane, and he can hear the questions and answer them back. The design of this place of the operating room also is being in a way that helps to maintain stability during the surgical procedure, where the floor is being reinforced with honeycomb. It's being put in line with the wings of the plane so that the surgery is being performed with no disturbance of any wind or any movement outside the plane.
We work side by side in hands-on training. We also use all adult education methods. For example, we use competency training. We put together also hands-on learning. We use online CyberSight, which is a telemedicine website, and we have that available in English, Chinese and Spanish, and we're looking to expand.
Yeah, this one is it's an OCT. It's very sophisticated equipment that will take images of what's behind the surface in the eye, so you can get the different thickness of the different layers inside of the eye. So that uses light, and it's a very fast and very nice piece of equipment. It's ophthalmic surgery simulator, so it's what the doctors can use this to practice before they go on to operating on real eyes. So it's almost like a flight simulator only for eye surgery. So this is very popular. So during programs, the doctors will sign up to work with this simulator here.
It's a truly heartwarming and amazing experience to be able to meet and work with nurses from different parts of the world to help them, to teach them my skills and to learn from them. It is truly amazing.
When we perform a program in one of the developing countries, this is a long process. Before the actual program happens, a team goes there several times before to prepare for the program. We go in at least 6 months before the program in what we call the initial visit, and there is 3 months before the program, which is called the intermediate visit, and 1 week before the program. During those visits, there is an interaction with the local doctors into gathering or choosing a number of patients who are going to be screened when the program starts. So when the plane arrives in that country, the first day is what we call the screening day, where we screen a number of patients who are chosen by the local doctors, thinking that these people can benefit from the surgery, and then we can help to perform the surgical procedure for demonstration, and they can do it and with good outcome. And following that, we choose the number of the patients that we're going to do the surgical procedure for them. The surgical procedures take place both on the plane and in the local hospital. The reason for that, when we demonstrate how the surgical procedure is being done on the plane, then we take that to the local hospital so that the local doctors can perform that procedure using their own setting, their resources. So that will help us to train them how to apply that procedure using their instruments and their machine and their local setting, and helps to spot any gaps in the training or any gaps in the need of machines and equipment and instruments. Now, after the surgery is being performed from the patient, it doesn't stop at that point. Now, when the patient leaves the plane, we come to them the following day and we examine the patients after the surgery to make sure that that the surgical outcome was okay, there are no complications, and we give them all the necessary medications. Furthermore, we come back, a team of us, like for me, I come as a staff ophthalmologist, I come 6 weeks after the program to examine the patients that we have operated on to make sure that everything is going well, there are no complications. If they need anything, we can provide them well. If there's any questions that the local doctors have for us, that we can help them to properly manage those patients. And as I said, during the screening day, when we select the patients, we select the patients who are in need for that surgery, like patient who is bilaterally blind, who have a low socioeconomic level, who cannot afford to do a surgery, because we'll do the surgeries for free. We select the patients that we think that they will benefit from that surgery, will have a good outcome, and we will help them. So we are very strict in our criteria so that we can provide the surgery for those who really need that surgery.
So Orbis International, we are a development organisation, but we also provide health services and also health training. So we're also looking for both staff and also volunteer medical professionals in ophthalmology, anesthesiology, and also nursing. For our staff, obviously we're looking for people who can devote a long period of time to the organisation and achieve our organisation objectives, and they have to be comfortable with travelling for anywhere up to 4 to 5 weeks of the year, comfortable leaving their family as well. For our volunteers, they are very, very wonderful people from all over the world. We currently have volunteers from Canada, America, Hong Kong, Singapore, the UK, Manila, Malaysia, and also New Zealand. So they come from all over the world, and they bring with them a wealth of knowledge.
If any of you nurses out there have an experience that you can share, that if you work in an operating room with eye patients, it's a great organization to become involved with, and the experience will be a life-altering one that you will be very proud to be a part of.
Regardless of whether a volunteer or a staff member is joining us, they all must be interested in helping to reduce avoidable blindness around the world, and also to support the advancement of those nurses that we're training. It's fundamentally what we do.
Orbis International is very fortunate enough to work with some of the most amazing companies and individuals around the world. For example, FedEx is extremely important to Orbis as they take care of this aircraft as if it's their own. From a medical perspective, we have companies such as Alcon, who provide more than 65% of a lot of the equipment and consumables you see aboard this aircraft. Without those two companies, we wouldn't be able to operate as we do. Well, Sun Life is also extremely important to us as well. It's their help, their donations that help us continue with our India Eye Care initiative. The other 40% of our donations come in through very generous private donors. So we have a nice healthy mix of corporate sponsorship and private donors from around the world.